Okay, I've got 101, so it's a good idea for everybody to get started. I want to be sure that I'm being respectful of everybody's time. My name is Brian Dowd. I'm the Deputy Executive Director over Policy, Operations, and Compliance at the Department of Community Health and the sponsor for the electronic visit verification system. Voice is a little frayed this week. Been doing quite a few presentations of late. I want to thank everybody for joining us. It's been a year. We've been doing these town hall meetings now for over a year. We actually started in November of last year. So every month we do at least 2 of these, sometimes 3, one during the day, one at night. We are in the evening, not at night. We have another one tomorrow at 6 p.m. right before the Veterans Day holiday on Thursday. So just a real quick thing to start with. I want to thank everybody for their participation and continued participation in these town hall meetings. Through your comments, questions, and emails, it has really helped to shape the system. It's helped to get us to where we are aware of issues and concerns that you guys have in the provider community, and it's helped to really improve the product associated with the federal mandate of electronic visit verification. We start every EVV presentation with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. I'm happy to say that after a year of doing these presentations, I know our mission off the top of my head now. So presentation points. Today, we're going to have a little bit of a condensed presentation just because we've been doing so many EVV presentations. So we're going to give a project update, do some common issues or questions. Something we're very excited about is that we have a provider spotlight today. So somebody other than me to talk, which yay for all of us for that. We're going to do our third party update, and then we'll do a few questions and answers. So let's go through the project updates. Where are we with the project? As of November 1st, 2021, by policy, we are requiring that all providers submit their claims through the EVV system, whether it be a self-directed member who is self-directing their provider community or a traditional provider, whether or not you are using a third-party resource or you are using the state-sponsored free NetSmart resource. We are requiring that all claims via policy get submitted through the EVV system. Now, there are 3 exceptions to the November 1st mandatory EVV claims deadline. If you have a member that has a patient liability or cost share, and this would exist in the CCSP and source programs, I went back and checked. There are no individuals with cost shares that receive personal support services or community living supports in the NOW, COMP, or ICWP waivers. So this would only be applicable to CCSP and source. But if you have members that have a patient liability or cost share, those are exempt from the mandate and can continue to be delivered through, billed through the GAMUS system. They do not have to be billed through the EVV system. And we would encourage you to go ahead and build those members with a cost share through GAMUS. If you have a client that has a shared services code, and we'll go through those codes on the next slide, and they are specific to the NOW and COMP waivers, then you may continue to bill for those services via the GAMUS system. Also, if you have any claim with an open tier 2 ticket with NetSmart, then you can continue to bill for those issues through GAMUS. Now, I want to assure everybody that we monitor the call center daily. I actually have a staff member that's all she's doing now is monitoring the call center. And we look at open tickets all the time to see what are the patterns, what are the concerns with open tickets to make sure, are they onesie twosie or are they a systemic problem? So you don't have to send me the tickets, right? You don't have to say, hey, I have a tier 2 ticket open with NetSmart, Brian. Some of you guys are sending them to me. Some of you guys are sending me emails and asking me to open a tier 2 ticket. And all I'm doing is referring those to the call center. So make sure you just stick with the call center on that. They'll either resolve your issue right there when they're on the phone with you, or they'll open a tier 2 ticket. They'll give you that ticket number, and then you can bill through GAMUS to make sure that you're continuing not to have any delays in your claiming. If you do have questions about these exceptions, you can always feel free to access the EVV mailbox, which is right down here at the bottom, evv.medicaid@dch.ga.gov. So we promised you we would show you those tier 2 codes. Here they are. They are all in, as I said, they're all in the Now and Comp. They all are community living support services, whether they're traditional T2025 with a U4 or U5 or UN and UP. And then, of course, the self-directed mirror services for those. Same codes, you just add an additional modifier at the end, which is UC. We actually don't have any co-employer services in the middle. I don't think we have any of those that are available. So you're really just looking at these T2025, U4, U5 with UN or UP modifiers. And then the additional ones, which are the same services for self-directed, just with the UC at the end. These are your shared services codes. I've had a lot of folks in the elderly and disabled waiver and ICWP say, well, are my shared services codes that I have T1019 and T1019TF at the same time? No, those are not shared services. Those are two separate services. One is PSS and one is PSS extended. They are not shared services codes. Only these codes are the shared services codes that allow you to bill through GAMUS. Next, I really want to talk just very briefly about case management functionality. We still are on target for November 11th, 2021. We will be sending out communications very shortly. We do have a listserv that is voluntary with all case management names on it, but we will also be doing banner messages and putting stuff on our EVV website for those who don't voluntarily choose to do the EVV listserv. This is a big benefit to case management. So I would assume that all the case managers will want to afford themselves the opportunity to have this enhanced tool in their toolbox. But again, it is not mandatory for case management. We will also have a checklist on the EVV provider page that provides information for case managers, administrators, support coordinators that shows you guides on how to register, how to sign up, how to use the system, how to get that messaging and the look into what's going on. All right, let's go over a few common issues and questions. We had a lot of questions out there about the adjusted rate in the Appendix K for community living supports, that temporary rate adjustment that was put in for the public health emergency. You may or may not know the waiver for Now and Comp has not been renewed. So any permanent rate adjustments have not as of yet been approved by CMS, and they are not reflective in GAMUS or EVV. But the temporary rate adjustment associated with the Appendix K does now show in EVV. If you have an unmatched visit and it's showing an old claim, an old amount, which it shouldn't anymore because unmatched visits rematch hourly. So it should have updated the rate when the unmatched visit went in and tried to rematch. But if you have a matched claim with the old rate in, you can manually go in and click on the match button on the EVV system, and it will readjust that rate to the correct rate for you. If you are having any questions with rates or concerns about rates, then you need to make sure you shoot an email or call the EVV call center, and we have that link here, and we'll have it later in the presentation as well. If you continue to have missing members or missing prior authorizations, you can report those to the EVV call center as well. Now, it's important to know if GAMUS doesn't have a member or a PA, then EVV is not going to have a member or PA. I get a lot of questions from you guys that say, hey, my PA or my member is not showing up in EVV. And then I'll say, well, what is their GAMUS PA number? And you'll say, oh, well, they're not in GAMUS yet. And I'll be like, well, if they're not in GAMUS, they're not going to be in EVV. We didn't change anything about the fact that the member has to be eligible for Medicaid and they have to have an active PA before you can begin billing for services. And so that still stands with EVV. Once that information gets into GAMIS, it will then transmit over to EVV. Usually it's 3 business days or less for that to happen. But if you are still missing members or missing PAs, please contact the call center and provide them with that PA number that is in GAMIS. So you need to monitor your service unit usage. One of the things that I'm getting a lot of questions about, and we're getting a lot of questions about, is, that, okay, well, I'm seeing that something's not paid, or I'm seeing that in EVV, I have units that are left. But what's happening is you're billing EVV and out of GAMIS. You've been historically billing both. Well, EVV doesn't know about the claims that you've billed from GAMIS. It's just subtracting on your administrative portal the number of PAs that you have billed through GAMIS. And billed through EVV. If you bill through multiple avenues, then EVV is not going to reflect the units that have been billed out of GAMIS. You also need to make sure that if a claim has already been paid, then an adjustment may need to be made. Adjustments to paid or partially made claims don't go through EVV. If you have to do an adjustment, you need to go ahead and do those adjustments like you always have for right now through GAMIS. And that won't always reflect 1-for-1 in EVV, so you just need to be aware of that. We're also getting quite a few people that are calling us and saying, hey, my aide is saying that they are at the member's house, but when they clock in, it's not showing they're at the house. We believe you. We absolutely positively believe you on that. So what we're seeing is that a lot of folks' phones aren't calibrated correctly. So if you are having repeated trouble with GPS issues, that individual can call and make sure that whether they're connected to Wi-Fi or the mobile app, they can call the call center and we will help you make sure that that phone is actually calibrated correctly. But you need to make sure that they are checking in and checking out when the service starts. And I'm going to talk, I don't even think it's one of our common issues yet, but I'm going to go ahead and pause right here to say one of the other things that I'm getting a lot of is, overlapping schedule issues. And sometimes there is absolutely a problem within EVV that we need to address. And this is the scenario, and we're working to address this. Brian is the aide. He works for Mr. and Mrs. Smith. He works for Mr. Smith between 9 a.m. and noon, and then he starts working for Mrs. Smith at 12:01 to 4. And we're seeing that back-to-back schedule from the same aide, where they're trying to bill in and bill out of that, is causing an issue. But what I am also getting messages about is Brian works for Mrs. Smith and Mrs. Wilson. And he works for Mrs. Smith at one address from 12 to noon. And then providers are trying to clock in at 12 to 4 or 12:01 to 4 at an address that is 5 or 6 miles away. And they're actually going in administratively and adjusting those claims so that they are getting the full 4 hours from 12 to 4 and the system's kicking them out. That is appropriate. There is no way that Brian can end a shift at 12 o'clock and then start a shift 1 minute later, 4 miles away. Not unless I'm the Flash or Superman or have some teleporter that can get me 4 miles away within 1 minute. So we need to be careful as providers when we're going in and adjusting administrative claims that the adjustment we're making makes sense. We don't pay for travel time, right? We pay for when the services start. We actually do pay for travel time. Travel time is built into the existing rate for service. It's not a separate billable component, however. So we're not going to pay for the time between point A and point B for services to be rendered. When that individual, when Brian showed up at the new address 5, 10, 15 minutes later and started services, that's when Brian should have clocked in, because that's when he's starting services. We're not billing based on the schedule. We're billing based on when the aide is delivering services. And we are getting a lot of adjustments where we're adjusting out for schedules that are not, they don't actually display when service is actually being delivered. I also want to remind people that claims submission deadline is now Thursday at midnight and not Friday at noon. It did back up for 12 hours. And that is, a lot of folks are still getting confused about this. They're saying, hey, they're submitting their claims on Friday and they're saying, hey, I'm not seeing the claims at the end of the week. Yep, if you don't have them in by Thursday at noon, you're not going to see them to the next week. And that Friday is going to be billed on the next week's payment cycles. When GAMUS releases the money to you has not changed. I've gotten several questions this week saying, GAMUS changed the day they released money into my bank account. No, they haven't. We went back and checked, and the money is still being delivered on the same day that it always was. Rounding rules. Due to you guys' very great input, we have decided and reacted to the fact that we needed rounding rules. We followed the Medicare rounding rules. So anything 8 minutes or more rounds up, anything less than 8 minutes rounds down to the next 15-minute unit. In ICWP, and this is only in ICWP, we bill on an hourly unit. So 30 minutes or less than 30 minutes rounds down, 30 minutes or more rounds up. So again, these are very common rounding rules. They're same rounding rules I would have learned in the third grade, probably before that even. But they're 8 minutes, less than 8 minutes rounds down, more than 8 minutes rounds up, 8 minutes or more. We are additionally seeing a lot of duplicate claims editing. If you are getting errors for duplicate claims editing and you know your aide is only billing in and scheduled at certain times for you, then you are welcome to write the EVV mailbox and we will research those claims. We have dedicated staff now within my unit that not only monitor the call center and performance metrics for the EVV system, but they also are going to start doing some investigations on what we are seeing out of the EVV system for providers. So we can certainly look into what those issues are for you if you just write the EVV mailbox. Okay, now we're going to do something a little bit different, and I'm really excited about this. I'm going to control the slide deck, so just tell me when to go forward. We have a guest speaker today, which is Sam Dalaman. He's the administrator from Omega Home Care Services in Atlanta, and he's going to talk to you a little bit about his experience in EVV. Sam, take it away.
Can you hear me?
Yeah, I can hear you.
Okay, I kind of hear the echo. Okay, my name is Sam Dalaman from Omega Home Care. You can go ahead, go to the next slide. Yeah, Omega, we use a third-party EVV vendor for Matrix Care. So we got kicked off quite early, approximately 2 months prior to the first claim submission deadline for EVV on July 1st. We conduct a weekly meeting with our vendor to help support with the implementation. Create a caregiver schedule and manage plug and plug activity through Matrix Care. Create invoices and submit a claim weekly through Matrix Care for uploading automatically to NetSmart for processing. Claims are reviewed and open issue resolved via email, phone call with NetSmart and or Matrix Care. Some tricks and tips for us. We had to train our caregiver in a small groups of 5 to 10 for approximately 2 months, almost every day. So we had to retrain our caregiver over and over in some case. And some of the lessons learned and challenge we encounter at the beginning, we had a lot of issue where we could not get any claim through NetSmart. Starting from July 1, for a period of 3 weeks, we couldn't do that. And then after that, we had a lot of issue with PA not found, PA missing, but they were, we were able to get them all resolved through NetSmart support team. We cut off our paper timesheet on July 1. We had a lot of pushback and complaint from some of our caregivers that are working for our agency that delay the EVV onboarding. So at this point, we are fully EV adopted, and the claim submission and edit are going through the NetSmart since October 1. Back to you, Brian.
Thank you. So what I've really taken from Omega Home Care and their ability to really get ramped up and fully working is they started early. They started early in the process, and this is not to highlight any third-party vendor. I know you guys have heard me say for over a year now, we really don't care whether you use a third-party vendor or the NetSmart system. We would actually prefer you use the NetSmart system because it's easier for us rather than have to do extra work to go through a third party. But we also have been committed to being an open model since the beginning. So we wanted our providers to have options. And Omega is a real good example of where they've used a third-party system and they've been very successful in the implementation of their third-party system. So we wanted you, rather than just to hear from me all the time, or me put up a slide, that you actually hear from a provider firsthand, since we've done a fair amount of work with Omega and they seem to be in a really good place at this point. Okay, let's go through some third-party updates. As we were just talking, this is becoming the ever-growing list of options for you to use. And I'm gonna have to count this again because we were at 30 last month. So now we're at 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. So now we're at 34 vendors, including the NetSmart system, that are fully compliant with the EVV system in Georgia. You have 34 options of EVV systems in the state of Georgia that you can use. And let me just assure everybody on the call, that is more than any other state. I talked to all the states now. We recently went first through certification review with CMS. So I'm getting a lot of requests from other states to talk to Georgia about our certification review process. And they are all pretty amazed that we have such an open model with so many available providers. There are states out there that mandate that you use the state system, you use the NetSmart system. There are even states out there that mandate you use a certain system that they don't pay for, which was shocking to me, but there are states that do that. But in this state, we try and give you the best of both worlds. You can use the NetSmart system, which is free to you to use, or you can choose any of the rest of the 33 available options for you to use, and you can get fully integrated through those systems. There are a few more even outside of the 34 that we continue to work with. And those are listed here as well. And we're making progress with all of these as well. There are a few more that have reached out to us and either said, hey, we're not interested in integrating in the state of Georgia, or we really don't have any clients in the state of Georgia. If you are working with any of these folks, you really do need to talk with them about whether or not you are going to continue to work with their software system ongoing. Okay, I'm going to pause here, but before I pause here, I want to make sure that you have the call center support information, which is down here at the bottom, 833-701-0012, or the email, which is gaevvsupport@conduit.com. A lot of times, guys, you'll send me individual specific questions to the EVV mailbox or my own mailbox, and I continue to just forward them to the GA EVV support mailbox so that not only it can be addressed, I don't have access to fix the coding in your system or into the EVV system. So the NetSmart and Conduit people are going to have to do that. Plus, we need tickets open. We need tickets open so we know who can continue to bill through GAMUS. So it is very important that you start the process with the EVV Support Center. Okay, let's take some questions. So let's go. I got to go back up to the top because it's a different way of doing this. So forgive me. If you use a third party, how do you verify payment in the TELUS system? So payments are verified in the GAMUS system. You should continue to look at your remittance advices and make sure that your remittance advice matches up to your claims. Now, I'm just gonna be honest with you guys, I've been shocked at how many providers don't really know how to use their remittance advice. So if you don't know how to use your remittance advice, you can contact the EVV, not the Georgia EVV email, but my EVV email, the state EVV email, or me personally, and I will set you up with a GAMUS representative who will walk you through what it is that you need to do and really do some education with you on a remittance advice. Is there a way to get a copy of the shared services code? This presentation, like all presentations since last November and all recordings since last November, will be posted to the EVV website. Do we continue to make corrections for claims in GAMUS? Yes, that's in one of the slides here. That is correct. Could you please share NetSmart's tech phone support number? You will go through this number right here at the bottom, 833-701-0012. How to know if claims is rejected or denied Thursday. If you want to look and see on the day, you can look at ICNs in the GAMUS system. When will the rate change for EDWP waiver? When it is approved by CMS, which it has not been yet. So should we not start services until we have an active PA and EVV? So the active PA and EVV and starting services is the same as it has been for all services when you have a pending PA, regardless in Medicaid forever. You can choose to start services or not start services when they have a PA that is not in GAMUS. That's a choice you can make as a provider. If you have a PMAO, you can choose to take PMAO clients or clients without PAs. You know, that's really a business decision. I can tell you, if you have a PA for that, an active PA for that member in GAMUS, you are covered. That GAMUS system is the source system of truth for PAs. So once you see that PA in GAMUS, you can feel 100% secure that it's going to get to EVV. And as soon as you see it in GAMUS, you can actually call the call center and let them know, hey, this PA is out there, I need it updated. Again, you will know if claims are paid through the RA. If you have, if you have a few caregivers who cannot bill EVV due to GPS issues, you can bill those through the administrative portal. You can manually enter in visits through the administrative portal. And if you need training on how to do that, you can contact the call center here at the bottom, and the call center will walk you through the applicable trainings in order to see how to do that. Also, one of the things I get a lot is, well, there's no Wi-Fi at the house. There's no connectivity at the house. The system can work for 12 hours offline. The aide, the staff member, simply needs to sign in somewhere where they have connectivity. And then when they get to the house, they will work offline and it will transmit when they re-get to connectivity. Is it possible to get notification from NetSmart when a missing member comes live on EVV? Currently, we randomly check. We can certainly bring that back to make sure that there is a communication loop if you have reported it, that it gets back to you. We will absolutely bring that up. The task sheet for each RN has to be signed by an RN. if we are to print the report for EVV, which report do we print? You would print the visit detail report. So, and there's more to this. It's about documentation. And what I want to say to that is everybody who has, if you have documentation in the system, that documentation will be able to be seen by the auditors. So you don't need to redocument. You would just need that issue. Okay, we're sorry about the echo. Got a lot of questions here about echoes. So we will try and make sure that is corrected for the 6 p.m. tomorrow. Some concerns about, you know, how long it's taken for caregivers to be trained, and 2 months. I am going to remind folks at this point, I totally get that it's frustrating. I do need to remind you this is a federal mandate. This isn't a choice thing. This is a federal mandate for continued compliance, and we do have to do it, or we will face huge penalties to the program. Think, you know, that we wouldn't be able to provide services, or we would have to do massive rate cuts without the ability to show the federal government that we are compliant with EVV. So it is really important, and I know it's frustrating, and I know we have to continue to work to make the system better, but we have to comply with this as it is a federal mandate for continued participation in the program. You contact the call center if you have a missing PA. If a claim isn't in the GAMIS system, you need to call GAMIS and ask them where your claim is. Missing procedure code for LPM visit not showing, nor is it in the PA. So EVV is only for personal supports and community living support services. So I'm going to encourage everyone to go back to the EVV website. And if you need to know how to get there, just go to Google and Google DCH EVV, and all the applicable codes for EVV are on the first page. Review those codes and make sure you're not trying to bill for codes that are not EVV codes. If you have an approved client that is not listed in TELUS and they are in GAMIS, you need to get that GAMIS number, and then you can call EVV and they will make sure they're in the system. A question about unlinking or editing a caregiver information in the EVV system. You have watched the training videos. Thank you for doing that. You have a screenshot and emailed to EVV support and did exactly what instructed to me, but no results. You will need to re-engage the call center, or you can send me that information and we will escalate it to management to walk you through again what you need to do to edit or unlink a member. I've done it a few times myself for training, and I know it can be a little tricky. So we'll definitely get somebody to walk you through that again. Yes, so there is an administrative function to the system that allows for editing, and that is fine with an appropriate reason. So I'm going to say what I've said 100 times on this email, on these town halls, and it's not, I know it's not, you know, the nicest way of putting things, but I think it's the most direct way of putting things. As long as you're not committing fraud, you shouldn't be worried. The system's not going to catch people and say that they're showing fraud when they're not doing fraud. It's just not. You should, if you're not doing fraud and you're correcting administrative things, or correcting when somebody forgot to clock out, or correcting when someone forgot to clock in, that is all perfectly normal. And we recognize it's happened and it's easy to explain. So you should never have fear about correcting things that are in the normal course of business. Next question is, you have an approved client aid and PA in TELUS, but the diagnosis codes are not in TELUS. You need to make sure that those diagnosis codes are correctly in GAMIS. If they are, you just need to provide the PA diagnosis codes to EVV, and EVV will correct them. If it is a problem with the interface with GAMIS, we have a meeting every single week, twice a week, between GAMIS and EVV to do those type corrections. Yes, effective November 1st, you can no longer bill directly through the GAMIS portal unless it's for one of the 3 conditions that we talked about. Diagnosis codes are available, should be on your plan of care, and it should also be available in your PA. Continue to get pushback from caregivers regarding clocking in and clocking out at the correct location. Can they call the call centers with their complaints or concerns, or there is a different contact? So if they're saying that they're clocking in and so we're not going to run your business for you. So let me be clear about that. So, and I'm sorry for being that blunt with you. We're not going to manage your staff. But if what they are saying is that there is an error in the TELUS system with the GPS location, then we're more than happy to walk through the call center. They should call the call center so we can make sure that their GPS is working correctly. What is an entity code? I'm not sure what you're asking for there, so you may want to do a screenshot and resubmit it to you. How to submit a claim after it was rejected by Medicaid due to diagnosis being clogged. You can rematch that claim and it should resubmit to GAMIS, or you can adjust the claim onto GAMIS right now. So you need to, there's another question about, 2 questions about RN sign on task sheets. So you would want to print out the report we talked about earlier and have the RN sign that task sheet. Any information that is not in GAMIS, that is not in EVV, you still need to document. If the information is in EVV, the auditors will have access to that and you do not need to redocument. So individual claims numbers individual claims issues should be called in to the EVV center. Nothing has changed about our documentation status. Please write my email address. I'm shocked there are people who don't know my email address. I get 300 emails a day. So sure, I never have a problem giving you my email address. It's my first initial and my last name, which is bdowd@dch.ga.gov. So I'm going to go ahead and put that in there right now for you. So everybody has it. There you go. Let me just go with the last questions, which is once we send claims over from third party, what do we do after that? You reconcile your claims through the remittance advice that is available on GAMIS. Okay, that's the end of our questions. As always, if you have other questions, you can feel free to call the call center. You can feel free to call the EVV call center. You can feel free to write me personally if you need to. Thank you, and I hope you have a wonderful rest of your day.